Have you or a family member ever struggled with your vision and were told by an eye doctor that nothing else could be done? There's no glasses, there's no contacts, surgery, eye drops, or anything that can help improve their vision. And that may be true. However, there are tons of resources out there that can help. My goal with these video series is to introduce you to certain devices, resources, and help educate you on how to manage and navigate vision loss. My name is Dr. Lindsay Lear. I practice at Ophthalmology Associates of Osborne, and I'm hoping to help everyone see things differently. So what is vision loss? Vision loss can occur from macular degeneration, diabetic eye disease, glaucoma, traumatic brain injury, even cataracts that are not appropriate for surgery. But the most common loss of vision is related to age-related macular degeneration. Over 40% of people aged 85 and greater, per the CDC report last year, have some form of macular degeneration. This is a huge number, and a lot of people that come in that have family history of some kind of eye condition that's a chronic or age-related eye condition should have regular eye exams because of that. Whether it's macular degeneration, glaucoma, diabetic eye disease, all of these things can have irreversible damage and lasting effects on vision, both central vision and peripheral vision, which can affect function, can't see to read their own mail, be empowered to work at a job, watch TV and enjoy the shows that they love. Sometimes even driving is limited or restricted or even revoked as a privilege. I want to start talking about resources. When someone has vision loss and they're told that nothing else can be done for them, it can feel devastating and overwhelming. And what do you do with that if you're a family member who's trying to support someone? The next step is to find a low vision specialist, because an eye doctor is going to focus on your medical eye health. A low vision specialist is often an eye doctor, but they have additional training and knowledge in the realm of functional vision. Functional vision is looking at how a patient manages doing their daily activities, what their goals and their hobbies are, what's important to them, and helping match their level of vision loss with the appropriate devices that are going to help them meet and match those goals and help them to continue the things they enjoy or need to do. For instance, if you're living on your own and you have to look at your mail and bills and you have to be independent, reading is one of the first things that's impacted by vision loss. So that's often the first thing that I focus on with my patients, is looking at ways to help empower them to make things large enough to see or utilize equipment that can read things to them or apps and help them to meet those goals. There are lots of magnifiers out there, digital equipment, apps, there's talking devices, there's head-mounted equipment, there's all kinds of things out there that can give someone the independence and empower them to utilize what vision they have left or not even use vision to do what they used to be able to do. Finding a low vision specialist can sometimes be a little tricky, but I want to share some resources to see if there's one near you. If you go to the American Optometric Association's website and find the page that says Find a Doctor, scroll all the way down and filter your search to include the vision rehabilitation or low vision specialists. From there, you can see where in your state the closest low vision specialist is located. Our Western Pennsylvania Optometric Society also shares a more localized list for those in the Western PA area. You go to the Western Pennsylvania Optometric Association's website and you can find a doctor that's closest to you. Vision loss affects everyone in the family, not just the patient. And so I just hope that I can help everyone see things differently and to have hope despite the loss of vision. Stay tuned for the next video.